Hello, everyone. Happy Friday. I'm Rendi Murphree, Director of Disease Surveillance and Environmental Health Services at the Mobile County Health Department. I'm here to give you our Friday 2:30 update on the impact of the COVID-19 pandemic on Mobile County, and also now to talk about the COVID vaccination efforts. So just to start a little bit with, what our outbreak looks like. Again, unprecedented, global pandemic with, many, many millions of cases and deaths. In Mobile County today, we're nearing 30,000 cases of COVID-19. So yesterday we added 185 cases. The total number, cumulative number, is 29,897. Today is 14 days past New Year's Day. So remember, we've been carefully watching the effect of gatherings on COVID transmission, gatherings that occurred over the holidays. So cases that occurred because of transmission during the holidays, we should have seen those by now. And we hope that we will start to see maybe a tapering off of the volume of cases reported. But of course, for every one person that got infected over the holidays at a gathering, they can transmit COVID to, on average 1.7, so a few other people. So we may not see a plateau for some time. And then the other complicating factor, of course, is that during the holidays, schools were out of session, so we weren't seeing cases reported in school-aged kids like we had seen in the fall. And now that they are back in session for instruction, in-person learning, and those after-school activities are picking back up, we will likely see additional transmission related to school-aged children. So nearing 30,000 cases on today, January 15th. The cumulative number of people who have died with COVID is 544. 4 were added yesterday. Mentioned before that the state has been working through a backlog of death certificates, cross-referencing it with our laboratory results to classify deaths as having been related to COVID that occurred many months ago. So the last report I heard from the state on that is that they had maybe 1,000 or so death certificates to still review, that they're hoping to work through that complete backlog over the next couple of weeks. We know that we are seeing deaths increase recently because we can look at the date of death and see the true pattern of deaths occurring in our outbreak rather than the number reported, which is what goes in our daily report. So take a look at the weekly expanded report if you want to see that we are having an increase in the number of deaths. We're still below the peaks that we saw in the spring and summer. The cumulative number of people hospitalized with COVID-19, 3,733, 35 were added yesterday. And then that very troubling trend of exponential growth in the number of patients hospitalized with a COVID-19 diagnosis. It's dropped a little bit. Yesterday it was 264. 2 days ago it was 264. Yesterday it was 273. So we're hovering in that 270s area, which is far greater than what we saw last summer. So before I move on to some questions and answers, and then a lot of talk probably about vaccine, I just wanted to review the concepts of quarantine and isolation. I think with a lot of additional, things being discussed having to do with vaccine and other COVID-related topics, we're receiving some reports and some requests to please clarify what the rules are right now for quarantine and isolation. So if you are COVID positive, if you test positive, or if you are symptomatic and COVID positive, you must isolate for 10 days, period. You have to stay home for 10 days. If you have a COVID positive test, whether you're symptomatic or asymptomatic, you stay home for 10 days. If you are exposed to someone who had COVID, so you were around them for at least 15 minutes within 6 feet or more while they were infectious, then you need to quarantine, preferably for 14 days, but Alabama is allowing an option that if you are exposed, you can quarantine for 10 days if you're asymptomatic, as long as you continue monitoring your symptoms through the full 14 days. So again, there is still not an option to test out of isolation or test out of quarantine. All right. So just want to reemphasize that we've not gone back to just, everybody can do what they want to do. Students, workers, friends, families, anyone who has COVID must stay home for 10 days. And if you're exposed, also stay home for at least 10, but preferably 14. That would be the best bet. All right. On to some comments and discussion and questions about the COVID vaccine strategies. So again, the health department is continuing to follow the interim COVID vaccination plan that was developed by the state health department. And right now, ADPH has approved vaccination for long-term care staff and residents, other healthcare workers, first responders, and people who are 75 and older. So that's what we're focusing on right now. We are not doing other, what people call 1B categories, 1B priorities. We're not doing school teachers right now. We're not doing manufacturers. We're not doing essential services like sewage and electricity services, those sorts of things. Right now, it's only long-term care facilities, and that's being done by Walgreens and CVS and Senior Care. And then the hospitals and the doctor's offices and the pharmacies and the health departments are responsible for assisting with healthcare workers, first responders, people over 75. That's where we are right now. We've gotten such a small amount of vaccine right now. I was adding up some figures, and if we're just talking about those four groups, let me pull my data here. Nursing home occupants, 75 and older, healthcare workers, first responders, that's nearly 60,000 people that live in Mobile County that fit those categories, 60,000. Mobile County Health Department has received 2,500 doses of vaccine. There is vaccine other, we are not the only one, but those of us in the county that have vaccine, we're trying to get as many of those 60,000 vaccinated first as possible. Then when we look at those other, priority one categories, like I was saying, manufacturers, public safety, food and agriculture workers, water and wastewater workers, food service workers, shelters and housing, public health workers, that's another nearly 100,000 people. So we can't just stay in 1A and then open up fully to 1B, because we would never be able to vaccinate those based on the very small numbers of vaccine that we have. So we have to roll this out in stages. And again, right now we are in a phase of extremely limited number of vaccine doses. That's why we're not able to open up to some of those other groups that really are necessary for the functioning of our economy, but not able to vaccinate you right now due to that limited number. And someone had asked me, said, well, you guys have moved on to first responders like police and fire, but, how are they different than grocery workers? And some of the thinking in it is that, police officers and firefighters during life-saving or during crime fighting, they are forced to come face to face with members of the public whom they have no idea, what their exposure history or COVID positive status is. In a retail setting, in a grocery setting, workers can maintain a 6-foot distance and protect yourself. But there are some, many first responders that, run into burning buildings and, have to be right in the face of people who maybe they're trying to, work with, who may have committed some sort of crime. So that's why police officers and firefighters have moved on to the list ahead of things like retailers or grocery stores. So let's see. I also wanted to mention just some general information. The ADPH has a dashboard on the number of doses that have been allocated Alabama, and I want to just talk through some of the terminology here because it's tricky to figure out the denominator that you're speaking to. So there have been allocations to Alabama. So the federal government has allocated doses of vaccine to the state of Alabama that aren't even in the state yet. This is just on a spreadsheet someplace or in a database. The feds have said, okay, Alabama gets this many, Mississippi gets that many, but they are not in the state yet. So if you see something that says the number of doses allocated, that does not mean that we have them available to us to put in arms. So the other terminology that we're trying to do is, or trying to use, is the vaccine doses delivered to Alabama. And that's around a couple 100,000, I think around 300,000. So that delivered to Alabama or in the state, sometimes you'll hear me say, those are the ones that are in the state, have been delivered to providers and are ready to be used for vaccine events. And then the third category is the total vaccine doses administered. So if the figure says administered, that means that they have gotten into arms and they have been entered into the statewide registry for immunizations. It's called MPRINT. So the state would like to get those shots in arms in the statewide registry within a day. But as you can imagine, this is brand new for all of us. We're all trying to figure out how to get this done as quickly and as efficiently as possible. But, we're new at it. So it will take us some time to streamline the process so that we can get as much administered and as much entered as we can. So the figure that I have seen is that of the 300,000 or so that are in the state, about 30% of those have been administered, and that includes the federal long-term care program, the pharmacy program, which is happening in nursing homes. It includes, the residents and the staff of the nursing homes, and then all of the other doses that have been given by hospitals, other pharmacies, by provider offices, that sort of thing. So just wanted to sort of talk through a little bit of terminology there as we embark on sort of a new phase of our communications with you. We just want to make sure that we get, some common language that we can use so that we can all understand one another well. We're still continuing to get complaints from the public. So it looks like we had only 6 this past week, 3 restaurants, 2 retails, and a daycare. We have about 17 nursing homes who are affected by COVID right now, who are reporting new cases of COVID. We're still working with them really closely like we have been to try to make sure that they have, the things that they need and that they are making the best decisions possible for their residents and staff. And again, that high priority population is being served with vaccination through the long-term care pharmacy program. All right. So a couple of questions, and most of these have to do with our vaccine event tomorrow. So let me go ahead and give you some information on that. So yesterday, wasn't Mark, that we sent out the news release? Okay, I'm getting a thumbs up. About the open to the public event that will be taking place tomorrow. The Mobile County Health Department is planning to give away 1,000 doses of COVID vaccine. So I'm going to read you some specifics about that vaccine. So again, it's really our first come, first serve open vaccination event. It's going to be tomorrow, January 16th, from 8 to 1:30. From 8 to 1:30, it's residents, Mobile residents are preferred, but residents 75 and older. And then from 1:30 to 8 p.m., healthcare workers and first responders. So you will have to bring your ID so that we can check your age, or we can make sure that you have, if you don't have an ID from your workplace to demonstrate or prove that you're a healthcare worker or a first responder, your ID badge will work. So no one will be vaccinated without valid proof of identification, demonstrating their age or their occupational status. And again, it's on a first come, first served basis. We're not taking any appointments. Here's some good information. patients should enter via Eslava Street, which is the cruise terminal entrance. We're going to try to have, we're going to have employees parking someplace else. So again, make sure that you have your identification ready in the car, because someone will be checking with you as you come in. No media will be admitted. Let's see, some other comments that we've made about, maybe bring a pen, a hard surface to write on, bring some water and some snacks in your car. Expect delays. Again, we're not making appointments, so you can expect there will be some delays. So please be prepared to wait. Bring your happy face, and please be kind to our staff and to others who are all in the same boat as you will be, really wanting to get vaccinated in the most efficient way possible. Yeah. So we also pushed in our media alert and our news release a link to a website where you can download the documents. If you have a printer at home, you can go ahead and download those documents and complete them and bring them with you. So a couple other things, sorry. We understand that the cruise terminal, this will not be a drive-through event. So the event tomorrow is not drive-through. People will park, and then you will receive instruction about coming into the terminal and maintaining that 6 foot of distance. So we will have a lot of people making sure you're wearing your mask properly, making sure you're maintaining that 6 foot of distance from people who are not in your household, that you're sanitizing your hands frequently. But this is not a drive-through event. There will be other events later that will be drive-through. City of Mobile, University of South Alabama has some things scheduled next week. We've heard that Baldwin County is scheduling some things next week that may be drive-through. So there will be other opportunities if you prefer a drive-through vaccination clinic. And then just really want to remind everyone that, there is a limited amount of vaccine right now. We don't know when we're going to get new allocations. It just seems to sort of be a hurry up and wait situation. And this is, a new process for all of us. And the complexity has, resulted in a few missteps. We've learned some lessons already this week from our soft openings, with our appointment-only clinics, of things that we can do better. And we're trying to get there. We're also trying to reduce the amount of misinformation that's out there. There was some information given on the news last night that was incorrect, so we're trying to correct that. So please, refer to communications directly from the health department for the most up-to-date and correct information on what the health department is doing for COVID vaccination. If you come tomorrow and get vaccinated, you'll be sent home. Well, let me cover up my date of birth. You'll be sent home with the vaccination card that looks something like this, that has the date of vaccination on the front of it. And then on the back, it will give you the date that is the earliest you should get your second dose. So if you come tomorrow, you will need to come back to the cruise terminal on that date. I want to make sure that's clear. So I don't want you driving from Mississippi or Florida to come get vaccinated in Mobile County tomorrow. We're preferring Mobile County residents, but the most important thing is that you're able to come back to the cruise terminal 28 days from tomorrow. So hang on to your card. Let's see. I'll try to answer a couple of questions now that came in from the media. These all have to do with vaccination. So there were some questions about, how was the event going to work? I'll say again that it is not a drive-through event. You will park and then follow instructions to safely enter the building, where we will be maintaining distance. Let's see. There is no residency requirement for getting the vaccine, though we prefer Mobile County residents because of that issue of you're going to have to return for your second dose. Let's see. There's been a lot of questions and I think misinformation and misunderstanding about the second dose. So I got lots of questions about that from the media today, and I don't know what all is being said nationally or by HHS or by Secretary Azar and all of that. I can tell you what happened in Mobile County. this week, the first dose we got was 500, right? So this week, we were told, go in and order your second dose, and we did, and we received it. So we already have the 500 second doses for the first allocation that the health department received. We were a little nervous, but we're not holding back vaccine for that second dose. We've been told that the second dose has been allocated, earmarked, reserved, whatever you want to call it. But we didn't have any problem this week when we had the opportunity to order our second dose. We did that, and it was delivered to us. So I hope that will maybe calm some of the concerns about the rumors or the misinformation or misunderstandings about what's being said nationally about the second dose. Let's see. People asking again, they had heard, some of the press had heard that other 1B groups would be able to get vaccinated. That is not true, right? Not true. Healthcare workers, first responders in the afternoon, 75 and older in the morning. All right, let's see. Okay, someone asking, I think I've already addressed that one. Let me just move on. Okay, someone was asking, I think this is the same person who asked about, how are police and firefighters different from grocery store workers? So I won't go back into that. It has to do with close contact. And then the question went on to ask, is this a decision that Dr. Eichhold or, could make on his own? And it's not. So the Advisory Committee on Immunization Practices, after the FDA authorizes an emergency use vaccine, the ACIP considers the data, makes some recommendations. Those recommendations go to the Centers for Disease Control. The Centers for Disease Control makes recommendations. The states consider that information and also the local situation to then decide what, phase or allocation strategy we're going to adhere to. So I know you've heard nationally that the president and some others, maybe even CDC, have said that they want to advocate for moving on to 65 and over, but the state of Alabama has not done that yet, again, based on the fact that we have a large group of people who we're still trying to saturate now with vaccination. So, and the limited amount of vaccine that's available to us. So we are doing our best to make sure that we are reaching out to those people who are prioritized so that, we can, again, saturate those groups, report it to the state, and then, let them use that information to decide when they want to open vaccine to other groups that are in 1B. Again, it's not going to be sort of an all or nothing thing. It will be sort of a phased, prioritization or allocation to some of these other groups as we receive more information on how much vaccine will be allocated to Alabama. All right, let's see. I think that might be most of what I was going to cover, except that just to mention that we do have, the health department has had on our books for quite some time a special partnership with community leaders of faith to have a day of service in honor and observance of Martin Luther King Day on Monday, January 18th. This was originally only going to be a COVID testing event. We have done many of these, church-based testing events, the Know Before You Go testing events, and this one has been planned for some time to provide drive-through COVID testing at Stone Street Baptist Church on Monday in honor of Martin Luther King Day. It's from 8:30 to 12:30. Since planning the event, we have received some free adult flu vaccine, and we will make that available on Monday. And depending on how many doses we give away tomorrow, if we have additional doses of COVID vaccine, we will make those available on Monday to people who are attending, that church's event if they meet the criteria. So if they're 75 and over, a healthcare worker, or a first responder. So we're really excited to partner with our community leaders of faith, with Stone Street Baptist Church in the morning to have the COVID drive-through testing event and drive-through vaccine event. And in the afternoon, just down the street, there will be a blood drive, again, a day of service in observance of Martin Luther King Day. The blood drive will take place at True Vine Missionary Baptist Church. So just a little bit of information about what we're planning to do on Monday. I'm sorry? Okay, Mark is reminding me that the health department and all of our clinics will be closed to the public on Monday. Most of us will be working, but our clinic locations will be closed to the public. So we will not have a 2:30 Facebook Live event on Monday. We will talk to you all again on Tuesday. Have a great weekend, and think about what you can do to observe a day of service in honor of Martin Luther King Day on Monday, January 18th. Have a great weekend, everyone.